Hi, I'm Chris Urquhart, publisher of Natural Awakenings magazine, and I'm here today with Dr. Angela King of Indian River Acupuncture and Functional Medicine. She's an acupuncture physician and doctor of Oriental medicine, and she's trained with masters in advanced styles of acupuncture. She studied classical homeopathy and has a keen interest in functional medicine. Thank you so much for being here today, Dr.
Thank
King.
you. Thank you for having me.
So we're hearing a lot right now in relation to the COVID-19 virus about a lot of people are just having a very mild illness. And then we're hearing quite a bit about the severe illnesses, the very scary parts of it where you're hospitalized and could be on a respirator and all of that. But it's my understanding that there is also a middle ground, and that maybe you could fill us in on what the other aspects of this illness can be.
Sure. Well, what I can share with you is what we've learned through our profession in Chinese medicine from the reports that are coming from the doctors on some of the front lines in China. University reports put out by Beijing University, Shanghai, and we're looking at their data that they've published in medical journals and hospital reports, and then just some first line, interview conversations that we're able to participate in with some of the doctors there. And what they're finding is that 80% number that a lot of us keep hearing about that says, oh, 80% of people who contract the coronavirus are going to have just a mild illness, no more than the common cold. And I think in the beginning that really got people into thinking like, well, why should I really be so concerned about this? Like, I'm healthy, I'm not elderly, perhaps my immune system is good, I hardly ever get sick. And, they just said, okay, common cold, I can deal with that. Well, what's coming out of China is that, and this was reported by the chief of epidemiology from the Chinese CDC. And he said that 80% cohort that had a mild illness is really in the category of what they call mild to moderate illness. And the people who who developed a moderate illness, they did actually develop a pneumonia and were quite sick, but just not sick enough to require hospitalization for a greater level of support through oxygen at the minimum, or, possibly all the way to mechanical ventilation. So it's not that 80% are just really going to have a common cold. It's about half of those may have a common cold, but the rest may have a true, a moderate pneumonia where they're very sick for weeks. Also, the moderate illness isn't something that just kind of comes and goes in 3 to 5 days like a common cold. I think that's also another misconception. Again, those reports from the chief of epidemiology from the Chinese CDC were saying, these illnesses on the short end are lasting 2 weeks. And then for people, in the more severe category, their hospitalizations are anywhere from 3 to 6 weeks. And people who are critical, anywhere from 2 to 8 weeks in the hospital. So, and then we know, a small percentage of those, somewhere around anywhere, the numbers vary differing on the country, but anywhere around 2 to 5% of those people are, actually dying. So, and that's after a long hospital stay and a lot of, suffering. So I think it's something that in that range. And also you'll see that what's happening now in the really hard hit areas is when they arrive to your home, if you call 911 and you have, a cough, a fever, you feel horrible, maybe you do have pneumonia, but if you're not severe enough to require hospitalization, their goal is to try to get you to stay at home until you're actually in, respiratory distress. So that's the time frame. And we haven't been as hard hit obviously as areas like New Orleans or clearly New York or Detroit or things like that, but this is what's happening in those areas. So we want to be mindful of that and have some strategies in place that if we do become sick, we are doing, anything that has some potential with evidence-based research behind it to support the body in regulating or modulating the immune system and reducing the potential for cytokine storm or high degrees of inflammation.
So a cytokine storm, that's not a familiar term to a lot of people. Can you kind of explain a little bit what that is?
Sure. So the cytokine storm is basically a hyper immune response to the virus. And certain people will develop this. And right now, from everything I've read, they're still unclear as to why certain people will go on and progress to cytokine storm and others won't. I did read a journal article entitled Into the Eye of the Cytokine Storm, and it reported some interesting information from studying the SARS epidemic of 2002-2003 in China, post-mortem studies where the people who died of SARS then were studied, and they found that a high percentage of those people had a certain genetic SNP, or single nucleotide polymorphism, sort of a change in their DNA, where they were more likely to progress to that cytokine storm and die. So perhaps genetics play a role in it. We might find that out. It's going to take post-mortem studies at the end of all of this to really quite understand, but that may be why you've got young people with otherwise no comorbidities, no underlying issues that are actually dying, becoming very sick and or dying from COVID. So what happens in the cytokine storm is it typically happens near, again, this is data coming out of China, and I'm from what we're seeing, this is holding up pretty well here in the United States too. For most people, on average, the progression from mild to moderate illness to severe illness, if it's going to occur in you, happens near the end of the first week or beginning of the second week. In China, the average was 8.1 days from the reports that we initially saw coming out of there, 8.1 days to progression to severe illness. So what happens in these people is their body, it's not the virus itself, but it is their immune system being hyper responding to this illness and releasing a bunch of cytokines, which are inflammatory, we have cytokines that are pro-inflammatory, and we have cytokines that are anti-inflammatory, that are naturally produced in the body. Well, this becomes an overproduction of these pro-inflammatory cytokines. You may hear the term like interleukin-6, and TNF alpha, tumor necrosis factor alpha. These are some specific cytokines that have found to sort of just be released out of control, and they start to damage the lining, the epithelial lining of the lungs. They start to, when that happens, you start to get pulmonary edema, leakage of that pulmonary fluid. You get this interstitial pneumonia that's developing, and you cause damage there where you can no longer, in the alveoli, where you can no longer exchange carbon dioxide and oxygen as efficiently as you normally would. So that is really more of this hyperimmune response. And then once that happens, interestingly enough, of all the research I've read in these PubMed articles and things like that, is they still consider this sort of a mysterious phenomenon. They don't really know exactly how to stop that. So you would think, well, if it's just this mass degree of inflammation happening, why don't we just squash it down with some steroids? That really gets, lowers inflammation. But a lot of the studies coming out of China from the original SARS epidemic in 2002-2003 showed that the high use of corticosteroids with this cytokine storm, people didn't fare well, because you might be lowering the inflammation, but you're also suppressing the immune system, and then the virus can take sort of a greater hold, if you will. So it's sort of an enigma, this cytokine storm, in terms of how to really effectively treat it. And as you can see, we're still struggling to find ways to do that effectively. So that's basically what can happen. That's sort of, I would tell people, that's the kind of turning point in most commonly in the illness, is around the end of the first week or beginning of the second week. It can happen more quickly, but on average, this is what the reports were saying.
So with that knowledge and knowing that that's a possibility, what are some things that we can do to put ourselves in a better position to not be one of those statistics, and that if we come in contact, we can try and do our best to stay on the milder side?
Right. Okay. So what I can tell you is from a functional medicine strategy, we have to be careful that we cannot say that any of these interventions or recommendations can prevent COVID. Okay, but we can look at evidence-based research that has tested certain nutritional supplements or compounds and their effectiveness against modulating the immune system and also lowering certain specific cytokines and down-regulating those that are pro-inflammatory and upregulating those that are anti-inflammatory. So with that, we can just draw from that research and advise people that, you know, better than doing nothing, right, and just sort of sitting around and waiting to see if you end up in the ICU, it would make sense to at least do some of these things to try to help yourself and see if we can mitigate that progression to cytokine storm. So the Institute for Functional Medicine, or the IFM, which is really the gold standard in functional medicine training, education, certification today, just put out a guideline, if you will, for nutritional supplements that have evidence-based research. And you can go on their website for IFM and look this up for anyone out there who wants to see this themselves. But basically, we're looking at things like vitamin C, which most people are, you know, aware of, but you may need to up your dose of that. Again, you know, looking at anywhere from 2 to 3 grams of vitamin C a day and higher if you do get sick. Vitamin D, certainly it's shown to be immunomodulatory in many studies. So we are now saying, you know, most people, if you're taking sort of a maintenance dose of vitamin D right now during the next couple of months, you may want to increase that anywhere from 5 to 10,000 units a day. Again, I have to say you should consult with your, you know, your doctor or your natural healthcare practitioner for your individual recommendations, but these are just general guidelines. Some other things that have shown to be anti-inflammatory in the way that we need them to be for this particular disease in terms of lowering specific cytokines, turmeric or curcumin, that's also has a lot of strong research behind it. But again, this is, you know, not something you need to buy off your drugstore shelf at you know, a big box store. And I say that only because to get a therapeutic dose of this, you're going to need a high amount per capsule. I mean, they're looking at, you know, anywhere of upwards of 1 gram or more a day. So that's 1,000 milligrams of turmeric. It should be standardized to 95% curcuminoids. Quality matters when you're taking your supplements. And for therapeutic efficacy, you have to take it at the dose, just like medicine, to be effective, or you're just throwing your money away, and worse, you're not going to get the benefit. Another supplement that they've shown, a compound that has been shown to be effective, is resveratrol, and also quercetin. So these are also compounds that people can use. I did read one study where I can give you that reference if we need to, but it was it was an animal study, and some of these, you know, are animal studies. However, in a situation like this, again, I think we need to just look at any research that's available. There was an animal study with mice, okay, where they induced ARDS, or acute respiratory distress syndrome, in these mice, okay? So they used a different pathogen to induce it than the coronavirus 2, but it was a bacteria that they used to induce it. But the end result is the same. They had the cytokine storm. They ended up with acute respiratory distress, same thing. So with these mice, they treated them, in the experimental group, they gave them resveratrol before they induced the respiratory distress, and another high dose afterwards. And in the experimental mice compared to control, the resveratrol did not, the mice without that had lung injury, acute lung injury, and the mice who got the resveratrol did not. So again, an animal study, but something to, you know, just put in your toolbox and consider consider taking that. For these supplements, for the most part, these are supplements that have a very safe index, meaning most people are not going to hurt themselves or harm themselves by taking these supplements. These are also supplements that tend to be very well tolerated in terms of most people aren't developing side effects or any type of allergic reactions to these particular supplements. So they are worth exploring for sure. Resveratrol, we typically would tell our patients upwards of 200 milligrams two times a day, 3 times a day, depending on what stage they're in. Other things to be mindful about in terms of strategies would be making sure your gut's healthy. So, up your probiotic at this time if you're taking one. Certainly other nutraceuticals that have shown some immunomodulatory action and anti-inflammatory action. Think about, high quality CBD oil, and possibly even think about something called pro-resolving mediators. And these are, they're called SPMs. And SPMs basically take, so when you think about certain anti-inflammatory agents like curcumin and fish oil and things like that, they really deal with helping to quell or inhibit the first stage of inflammation, and where macrophage expression is in the M1 phenotype. But they need that inflammation has to be resolved as well, and SPMs help move it from the first phase of lowering inflammation into resolving the inflammation through these pro-resolving mediators and turn it into an M2 phenotype expression, which is very anti-inflammatory. So you want to take your turmeric or your fish oil or things like that, but the SPMs can help give almost an extra boost to help you resolve inflammation more effectively, more efficiently. So those are some of the main things being talked about in terms of functional medicine strategies during this time.
Thank you for that. You covered a lot of very solid things that we can look at and consider doing. I really appreciate that information. You also, with your Chinese medicine background, perhaps have another perspective to look at this, in addition to the functional medicine perspective. So coming from the Chinese medicine way of looking at the body and the balance of the body, what are some of the things, and since this is coming from China, with the experience, what are some of the ways they're seeing that can help us support the immune system, reduce inflammation, those kinds of things?
Okay, so again, China has a lot of published now guidelines that are national guidelines for the treatment of COVID-19. Now, in the United States, we cannot, apparently the FDA, this is something that I just learned through our association, and I may not be quoting it exactly, but apparently the FDA doesn't want to look at research that's coming outside of the United States. And so they're being very careful to say we can't use words like prevention or treatment. So I will try to be very careful about that. But what I can tell you is that in China, there are multiple journal articles, reports coming from the hospitals, coming from the front lines, and coming from the government. So in the end of January, the leader of China decreed, if you will, that all patients in the hospitals be given Chinese herbal medicine alongside Western medicine treatment. So the data or the statistic coming out of China is that from near the end of January and forward, around 92% of patients across all provinces were treated with Chinese herbal medicine as well as Western medicine. Now, these are hospitalized patients, okay? But they also had they had all those makeshift hospitals they had to build. They had so many people to take care of that not everyone could get an individualized herbal formula. So what the doctors came up, which is the way that we would traditionally do it in TCM, traditional Chinese medicine. You know, you look at the tongue, you take the pulse, you listen to the symptoms, you'd prescribe one formula, and 3 days later in an acute illness, if their symptoms change, you'd adjust the herbs, you'd maybe even change the formula. Well, you can imagine, you know, when you have, you know, hundreds of thousands of people sick, you can't do that anymore, right? So basically, there was a consensus of taking a consensus among the Chinese medical doctors of taking 4 existing Chinese herbal formulas and combining them into one formula and they named it Qingfei Paidutong. So that particular formula was utilized in China for mild to moderate to severe illness across the board. And so they report a high effectiveness rate. There's actually a study that's been published, you know, that's in PubMed, where you can, I can link that for people if they want to read it themselves, where you can read about the different herbal medicines that were given. That was one of the main ones that was given because they were needing it for the masses. Now, other hospitals that had TCM branches were still doing their best with their herbal medicine doctors to individualize the prescriptions and things like that, but that couldn't happen everywhere. So this particular formula was used with good efficacy. There are statistics in that particular journal article in PubMed that tells you how many of the severe cases it was able to stabilize. It was a significant percentage, and how many of the mild to moderate illness, what percentage when they took this particular herbal formula did not progress to severe or critical stage. So the formula had over an 88% efficacy, which, you know, is reported efficacy, which is really high. The other thing that China did was they gave all of their healthcare workers in hospitals a formula that they use, and that in Chinese medicine we say it strengthens the Wei Qi to make the body more resistant to external invasion of pathogens. Okay, so trying to talk through that in Chinese medicine language, because again, we can't say prevent, okay? But there's a known formula called Yu Ping Feng Sun or Jade Windscreen. In Chinese medicine, in China, they were sometimes giving that by itself, sometimes modifying it a little bit, changing up some of the herbs to fit the picture, but it was based on that foundational formula, Yu Ping Feng Sun. And in at least one of the hospitals in Hubei province reported that they would, you know, when their healthcare workers came on shift, doctors, nurses, admin, didn't matter, they would first report to the herbal pharmacy in the hospital. They would be given their dose, recorded, and then when they left, they would be given their other dose, because the hospitals were regulating that because they wanted to ensure compliance among their healthcare workers, because if not, then they considered their healthcare workers a risk, you know, to other healthcare workers, doctors, nurses, and the like. So they regulated this. And of course, being a communist country, the government did pay for these herbs for all of the staff, all of the patients, things like that. So the access was there, the availability was there. And so you know, your audience may, if they have an acupuncturist that they're established with, they may want to talk to that person, do an herbal consult, and see if that particular Oriental medicine practitioner has a stock of any of these herbs or has access to them. One thing I can tell you is that the herbal supply chain here in the United States has become, because of COVID-19, has become very limited. So many of our main distributors are out of stock, with product not coming in until the end of April. So we check, it's like the old days getting a concert ticket where you were like, is it time? 10 a.m., push the button. So we're checking every day for is anybody back in stock? Can we get more? We were able to get enough for a large percentage of our patients to utilize that formula. And also we have about 40 doses of the herbal formula that was used in China for the sick individuals with symptoms of COVID. So we're able to take care of our local, you know, cohort. I wish that this would be available on a larger scale, and that we could, you know, talk to hospitals and other doctors. But the problem is even if we could do that, there isn't the supply.
Right.
You know, China was utilizing all of their herbs, and they're just now starting to export these herbs again to the United States. But you have to remember, I mean, these are most of the herbal pharmacies that are making these in huge, you know, bulk quantity. They are getting these herbs through container shipments. You know, these are being shipped. They have to go through inspection. They have, you know, so by the time you do that, there's a backlog. But if anyone out there has an existing, you know, Chinese medicine practitioner that may be able to help them in this way, I do feel that, you know, there's very solid reports coming from many different provinces in China, and also, you know, first line interviews with doctors, just like here. It's like, that's who you can, you know, really trust for your information, are the doctors that are on the front lines treating it. And we've been privy to, you know, be able to listen to interviews with them and how they are treating with herbs, and what they feel, you know, the effectiveness is and how much it's helped people there.
That's all just fascinating information. And we can also hope that those supply chains will loosen up as
Yes.
China
Yes.
moves past it, and hopefully things will shift, and we'll see more of what we need coming into our country as well.
Yes, I hope so too.
Well, this was a fantastic conversation. Thank you so much for sharing all of your research and knowledge. For those of you listening, if you'd like to be able to reach Dr. Angela, she's at IndianRiverAcupuncture.com. You can read more about their practice and her team, the others that work with her there at Indian River Acupuncture. And they can be reached at 772-564-8383. Thanks again for joining us.
Thank you. Be well.
Exactly. Be well. Stay connected, everyone.